Good afternoon. My name is Lucy Aquino, Chief Executive Officer of Hispanocare, Inc., a program of Advocate Illinois Masonic Medical Center, and you are watching CAN TV Cable 21. Today, for the next 25 minutes, we're going to be speaking about and talking about baby-friendly hospitals. New term. It's going out there. A lot of people are talking about it. We invite you to call in with your questions. Telephone lines are now open. The number's at the bottom of your screen. Area code 312-738-1060. Lines are now open. Joining me today is Karen Waltenbough, Director of Women and Children's Services, and Summer Kelly, Registered Nurse and Lactation Counselor, who will be joining us shortly, a little bit later, from Illinois Masonic Hospital. Thank you, Karen, for being on the show.
Lucy, thank you so much for inviting us. We're delighted to be here.
Well, this is wonderful to have you on board. I know that so many things are changing with health care, health styles, mind, body, and spirit. And with that being said, I know that baby-friendly hospitals is one of those terms that everyone's buzzing about today.
Absolutely.
I know that you see it in baby magazines, you're seeing it on the internet. But when we use that baby-friendly term, I know it sounds wonderful, but we're not really 100% sure what that means. Karen, you're the expert.
I will try to give you just a very brief description. I think it means a little bit different things depending on what you hear. But the World Health Organization helped to get this initiative going. And here in the United States, we've been working on what is called the Baby Friendly Initiative since about 1991. And what we're trying to do is help hospitals to reach out to our moms who are delivering and help them be successful at breastfeeding. So the baby-friendly term is just really, we're working to do the best for those infants. We found across the world that those babies, excuse me, that are breastfed do much better because of various factors with formula, mixing formula, using water that isn't sterile, introducing foods too early can really make a difference. And babies that are breastfed, ideally for at least the first 6 months, do better.
Wow. So I know that when the Baby Friendly Hospital Initiative was put together, or in short terms, BFHI, there was an initial 10 steps that were created. Can we talk a little bit about those 10 steps, Karen?
Certainly. Every hospital in the United States that delivers babies has been required to come up with a policy that supports breastfeeding. So even if they're not going to be a baby-friendly hospital, they are required to come up with a feeding policy for newborns that helps to teach about breastfeeding and encouraging breastfeeding. So that's one of the policies. They're also important that they have trained staff that are able to help to make sure that those policies are implemented correctly, and also information out there for pregnant women, helping them make the decision. Are they going to breastfeed? Are they going to bottle feed? And the importance of the decision that they make. Another one of them. Helping the mothers initiate breastfeeding as soon after birth as possible. Many of the hospitals in the United States, the thing that we're challenged with is the space in order to do that and the ability to do that. And with utilizing significant others who come into the delivery room, there are some hospitals that have been able to initiate breastfeeding within the first hour after birth, and they found that that makes for a much more successful experience. Also, giving newborns nothing but breast milk. No pacifiers, no water, no formula, unless it's medically indicated, is a very important piece. We find if you're supplementing a baby with a little bit of formula because you feel that it didn't go to the breast as long as you wanted it to, that formula takes longer to digest. That baby's not going to be hungry and take those cues right away. So breastfeeding only, very important, unless medically indicated. Also, 24-hour rooming in. This one you'll hear for hospitals all across the country. Everyone from my generation, the babies went to the nursery for the night. Visitors were coming up. The baby went to the nursery so that the visitors could come and visit mom. And so we've opened up visiting policies so that visitors can come into the room. We don't encourage moms to send their babies to the nursery, and especially at night, moms need to learn those feeding cues. They're very important, and so 24-hour rooming in, it's one of the things we've been very successful at Advocate Illinois Masonic, and one of the things that I think has made us much more successful with this. Encouraging breastfeeding on demand. babies, when they're first born, are not interested in being on a schedule.
Right.
You feed them when they get the cue
Right.
that they're hungry.
Right.
And so feeding on demand, another very important piece. And then helping by supporting support groups for that mom, hotlines for her to call when she's having difficulty getting the baby to latch on, engorgement issues, baby sick. What do I do? And so having some type of a support system is also a very important piece of the baby-friendly process.
But Karen, that doesn't mean that if you have the baby 24-hour rule, 24 hours of the baby's with you, it doesn't mean that if you feel that you can't handle it and you really need that break, that doesn't mean they can't take the baby to the nursery.
No, they're almost every single hospital across the country. Their nurseries have not been closed, and so even at Illinois Masonic, if a mom needs a break, we take the baby for an hour or two to give her a break. But I will tell you that I think the culture of our patients that come to us, they know we do 24-hour rooming in, and that's one of the reasons why they choose Illinois Masonic. We get a lot of support from our dads. A lot of times they know their wife needs a break, their significant other needs that break, and dad takes over the baby for that hour or so. You'll see them walking in the halls with them in the bassinet, helping with that.
Getting used to helping out. He's going to be up all night too.
Train them early.
Well, I think that's that's really wonderful that it's happening. But it's not just Illinois Masonic Hospital who's doing that across the country or in Chicago alone. There are quite a number of other hospitals in Illinois or in Chicago area. Do you know which hospitals are baby friendly?
Actually, right now, in Illinois, in Chicago, I think we have 2.
Okay.
In Southern Illinois, we have another one. They're very slow, but I can tell you there are probably minimally 10 hospitals in the Chicago area that are going for baby friendly right now. So it is something that is catching on. Governor Quinn has pretty much mandated to all hospitals that do deliveries to support breastfeeding. They don't all have to go baby friendly, but those 10 steps that I mentioned, they need to pick 5 of those 10 that they are going to follow, even if they're not going to be a baby friendly hospital. They are supporting breastfeeding.
Okay. That is huge.
It's huge.
All right, so you mentioned, supporting breastfeeding, that's great. I mean, we've known this. I think we've known this for quite a while now, that breastfeeding is always a lot healthier for your baby. At least that was the understanding. But, there are a lot of women out there and a lot of men who'll say, gee, my parents didn't breastfed me, so, and I turned out okay.
And we did.
It's a big deal.
I think we probably all did. Turned out pretty okay. And I think that this is something that you have to kind of put in context. In the United States, women used to breastfeed their babies all the time. I think especially right after World War II, with so many women going out into the workforce while all of our men were fighting, formula really started to take on because grandma was home with the baby. And so the dynamics changed, I think, of family life a great deal. But we have learned a lot over the last 10 to 15 years about breastfeeding. Not just breastfeeding, but the components of breast milk, which Summer will be talking about a little bit later. But there are a lot of things about breast milk that we know now that we didn't know later or earlier. And we have found that it really is a healthier way to go. It's introducing something natural. And especially for we're a level 3 hospital. We have a NICU that has very small babies. And for those really, really tiny babies, introducing breast milk as their first feeding is much better for them than introducing formula.
There's always so much to talk about because, you see all these changes happening, and again, to new words, a new terminology. And hospitals that are certified eventually will have outside of their hospital doors at the entrance saying that we are a baby-friendly hospital, correct? So they'll be identified that way, or on their websites if that's what you're looking for. I mean, a lot of information out there on baby-friendly. And what does it mean? It might not be for everyone.
No.
That could possibly be a good thing to do. And I know that brings me to where, not just this initiative, but I'm looking forward to hearing a whole lot more from Summer as well, because Summer, I believe, it says, I know, is the expert on this. So I'm going to bring Summer more. But meanwhile, if there are questions, I know that if any one of our viewers who are listening and wants to know more about lactation or has questions or even baby-friendly questions, if that's something you want to know about, please give a call to Illinois Masonic Medical Center at 773-296-7765. Again, that number is 773 area code 296-7765. So joining me now, we're going to switch here. Joining me now is Summer Kelly.
Hi.
Summer, thank you for joining us on the show.
Thank you for having me, Lucy.
Well, thank you. It's again, this is such a very interesting topic. I know that when Karen and I met a while ago, it was something that we wanted to talk about because it was something that was happening. And it was happening so quickly from when we met to where there are just so many hospitals now going after application for being baby-friendly hospitals. But that being said, breastfeeding, again, benefits. Summer, you're the expert. What are the real benefits? I know Karen alluded to some of them, but tell us, come on. What are the real things going on here?
Well, we don't have enough time to cover all of the benefits. I could talk for hours about this. Human milk is an amazing dynamic fluid that's been shaped by millions of years of evolution. There are thousands of molecular components in human milk that you cannot find in formula. A lot of studies have shown that when infants are fed human milk as opposed to formula, they have lower rates of not only ear infections and urinary tract infections, but very severe illnesses, including meningitis, pneumonia, sudden infant death syndrome, diabetes type 1 and type 2, and even asthma and childhood obesity.
Now, it's my understanding, too, that even tooth decay is part of that as well.
Yes, we all want a nice smile, but it's more important than that. Studies have found that human milk-fed babies have lower incidence of tooth decay, and other studies have found that if you have lower rates of tooth decay, that can prevent certain types of heart disease and even preterm labor in women.
Right. You know, you brought a wonderful prop with you. I really
Yes.
would like to bring it up if we can. I think this is something that everyone should see. And when you think about baby formula and you think about baby mother's milk, it's not always the case what people think. Can you walk us through this, Summer?
Absolutely. On the bottom here, we have components that are in both formula, which is over on this side, and human milk. These are the nutritive substances like fats, proteins, carbohydrates, and vitamins. So that's really the purpose of formula, is to provide these nutritious elements if we don't have human milk
Right.
available.
Right.
However, if you look over here, you can see a lot of important building blocks that human milk has that
Right.
is not found in formula. Living white blood cells, antibodies, hormones, enzymes, all of these provide important nutritive and protective functions that can protect babies against viruses, bacteria, and other types of infection and disease.
So hence, breastfeeding is really the best way to go.
Yeah, it gives your baby the best start in life, absolutely.
So definitely when you start hearing a lot, and thank you, I think this is a wonderful
Yes.
prop. You should take this everywhere you go.
Thank you.
But I do know that there are a lot of myths out there about breastfeeding. I mean, they're cultural myths, stories. But the reality is that those antibodies and those protective things that are happening happens for the baby. That baby's going to be that much healthier, less colds, less chances of developing diabetes or becoming that obese child. And obviously, obesity is a huge problem in this country right now.
Absolutely. And the studies are very compelling that human milk-fed babies have lower rates of obesity. Human milk is easier to digest, and infants that are fed human milk have a different pattern of eating. They eat smaller, more frequent meals, which is really the healthy pattern of eating. It gets them off to the right start.
Right.
And Karen talked earlier about people who say, well, I was formula fed and I'm healthy, or my kids were formula fed and they're healthy. And that may be true, but when you take a large group of children, maybe 1,000 breastfed children compared to 1,000 formula fed children, you will see differences in health outcomes.
Wow. And that's definitely, those studies are out there. Google it, go on the internet, find out information. But if you're that mom to be, whether it's your first child or whether it's your fifth child, and you've never breastfed before, it's definitely something to consider. So Summer, when the benefits, we talked a little bit about that. Now, I know, can you get into more details about some of the benefits? You mentioned some of them, but we talked, there's ear infections, diarrhea.
Yes.
There's just a host of other things. Can you name some of the others?
Yeah, absolutely. Breastfeeding protects against, even like you said, colds and respiratory infections. There are studies that show that
breastfeeding protects against certain types of childhood cancer like leukemia. So there's a lot of compelling evidence out there. The American Academy of Pediatrics strongly supports breastfeeding based on these studies. They recommend 6 months of exclusive breastfeeding with no water, no complementary foods, and to breastfeed up to a year or even longer as long as it's working out for both mom and baby.
All right, sorry, but I got to say this. I mean, I see this from a lot of new moms. Well, even moms who've had several children. And they always say, my baby doesn't eat enough. Breast milk just does not fill the baby. Baby's always hungry. I'm constantly feeding and it gets tiresome. So they supplement with formula. That's a no-no, isn't it?
It can be a no-no unless it's medically indicated.
Right.
But we're flexible. I would recommend getting the help of a board-certified lactation consultant if the mom's having problems. And also to remember that this is the natural way to feed your baby. Now that we have to go back to work, like Karen was bringing up, you can bring your pump to your workplace. The state of Illinois guarantees your right to pump at work.
That is good to know.
Yes.
I'm sure that a lot of moms out there don't realize that.
Yes, and they guarantee breaks for pumping in a place that's secluded and it's not a bathroom. So,
all right.
Yes.
Well, that is absolutely good to hear. Now, I guess the best part of all of this is, well, there's a lot of good parts to this. Obviously, the benefits of breastfeeding, helping your baby to live long, healthier lives. But the cost is free.
That's the best part about it. In today's economy, absolutely, you could spend thousands of dollars on formula. Breast milk is free, and you also save money because you don't have to take your child to the doctor as often. You don't have to miss work for sick baby visits. So breastfeeding is definitely the economic choice.
So let's talk about another myth. When moms are eating, and I hear this all the time. I have moms who have said to me, oh, gee, I had for lunch, some jalapenos, and I had some really spicy food, and my baby did not want his milk.
I'm so glad you brought that up. All of my moms asked me about diet and breastfeeding, and we used to have really crazy recommendations that we would give to new moms. Don't eat broccoli, don't drink coffee. Really, we've done away with most of that. We just recommend a healthy, balanced diet. Moms can drink coffee, they can have sushi, they can have, they can eat pretty much whatever they want. Their body is still going to make that awesome food for the baby that will support immunity and nutrition.
And it doesn't affect taste any for the baby, does it?
If anything, it helps taste because taste is developing at that time. Formula is pretty consistent. It always has the same taste. So the baby isn't exposed to different tastes. But human milk, some of those tastes do go through to the milk. And infants in India or in Mexico, where they do eat jalapenos or curry, don't have any higher incidence of colic or intestinal distress as American babies. So it's kind of an old wives' tale.
It isn't. So if you want something that, even while you're pregnant, you want it, eat it. Go get it. After the baby, the one thing you can do is pamper yourself. And if you feel like eating a bunch of jalapenos, go for it.
Here, yes.
So we talked about babies' formulas. So when is really the right time to introduce cow's milk?
Most pediatricians would agree that about at the baby's first birthday. So at 12 months of age, that's when we can introduce cow's milk, usually in the form of whole milk.
So whole milk, when it's being introduced, is it whole milk as a whole? I know a lot of people out there too will start with 2% or 1% milk.
Babies really need those complex fats that are found in whole milk. So even, I'm not aware, maybe there will be a medical condition that would warrant skim milk or 2% milk, but most of the time we do recommend starting with whole milk for infants.
If there was any advice that you can give new moms to be, or new moms, about breastfeeding and or formula, what would it be?
I would say to stay positive. Breastfeeding is a really positive experience. Even if you breastfeed for 2 weeks or 2 years, breastfeeding is an amazing way that you can help take care of your baby, ensure that your baby's healthy, and create that long-lasting bond. So I would say, find a good lactation consultant just to have that number or that contact in case you need any help.
Now, I did want to remind our viewers that if you have any questions for any of the consultants, lactation consultants over at Illinois Masonic Hospital, please give them a call. Area code 296-7765. Again, that number is 773-296-7765. And anyone there will be very happy to answer any questions that you may have. Now, I know that we're going towards the end of our show, but I did want to impress upon our viewers that the numbers of babies that die every year due to potentially non-breastfeeding is what?
Well, at least 1 million deaths per year can be attributed to suboptimal feeding practices, which is not breastfeeding. And it could be even higher than that. That's a pretty conservative number. We also estimate that about $13 billion per year are spent for, medical cases of not breastfeeding in the United States alone. So if you want to save money, if you want your baby to be healthy, I would recommend to try breastfeeding and to get help. If you deliver at Advocate Illinois Masonic Hospital, you will receive lactation counseling from a board-certified lactation consultant. We are dedicated to breastfeeding at Advocate Illinois Masonic Hospital, and we have staff there 7 days a week to support you. So we really have a very positive culture that supports breastfeeding at our hospital.
And again, that's for any hospital that's certified baby-friendly, which should also be doing exactly the same thing.
Yes.
And that is what the initiative is all about that Karen spoke about earlier. These are the things that need to happen for a hospital to be certified baby-friendly, correct? So those things are out there. Summer, we can keep talking about babies and formula and all the things that we need to do. We just want our babies to be healthy and happy, content. So obviously breastfeeding is the best way to go. We know that.
Yes.
We know that. Studies have shown it. It's proven out there over and over again. So moms-to-be, our viewers, anyone who's listening or anyone has a niece or nephew, if you have family members that you can give advice to, maybe direct them that way. Again, if you have questions about lactation or anything else, feel free to give us a call over at Illinois Masonic Medical Center, 773-296-7765. Again, 296-7765. Or any other hospital that's baby-friendly. We'll be happy to answer your calls as well. Summer, our time here goes by so quickly.
Yes.
So we got to make sure that we invite you back and we can spend a whole show just talking about the important things for babies to come.
I'll be here.
Expert. We'd love to have you. So remember that more and more hospitals and birth centers, even though they haven't been certified by Baby Friendly USA, are learning toward creating a more breastfeeding-friendly environment. So, moms, it is hoped that a rise in breastfeeding rates will improve children's health overall, and steps will be taken every day to ensure that mothers get off on the best nursing start as they start to feed their babies. So on behalf of all my colleagues at Hispanocare, Advocate, Illinois Masonic Medical Center, Karen Waltenbough, Director of Children's Services, and Summer Kelly, new name. I knew Summer when she had another name, but lactation counselor, we want to thank you for allowing us for being on the show. Thank you so much.
Yes,
and
thank you.
we invite you to come back, both of you. Let's talk further. So until next time, please stay tuned. A lot more information coming your way. Next show coming up shortly. Thank you for joining us this evening. Good night.